Are the benefits of sharing private health information being risked by carelessness of healthcare providers? Privacy became a challenge with the growth of healthcare as an industry when non-physicians would have access to information. There are undeniable benefits and risks to privacy associated with shared information. Electronic health records allow necessary sharing of information to be more efficient with fewer errors, and as a result there is a reduction in healthcare costs. But more people now have access to patient information, there is increased potential for breaches of privacy. Private information is essential for public health initiatives. Confidentiality is intended to protect individuals from harm caused by disclosure. Public health professionals must make exceptions in order to protect society from harm. Large databases allow faster, more reliable public health research into patterns of illness, effective treatments, and improved quality of care. The benefits of patient databanks have prompted the government to create a national health information structure, but privacy laws preventing access to information limits the effectiveness of epidemiology studies, posing risks to public health. There are penalties for anyone found in violation of privacy laws, ranging from fines and termination to lawsuits. Currently, laws are unclear as to how personal health information must be kept private. Federal laws contradict one another, and most states are not keeping up with legislation. There is more than the law to consider. Privacy is known to improve quality of care because patients are willing to seek treatment and share necessary information when they have trust in their provider. Research proves that patients are still concerned and unhappy with how their private information is being treated. A national study found that when asked, "How concerned are you with the privacy of your healthcare?" 68% answered very or somewhat concerned. A study on patient privacy satisfaction in the emergency department that included 360 patients at 3 different hospitals found that 50% said their privacy was observed on a weak or average level. Regardless of how important privacy is rated by patients, we all know it's supposed to be protected by the Health Information Portability and Accountability Act, otherwise known as HIPAA. Information that is covered includes information put into your medical chart, conversations your doctor has with other healthcare providers, and billing information. The U.S. Health and Human Service Office for Civil Rights has been responsible for enforcing HIPAA since 2003. Even with HIPAA, we still found many examples of privacy breaches. At UCLA, over 120 healthcare providers looked up celebrities' records over a period of a year and a half without needing the information. Psychiatric records of a 14-year-old were sent to her school after her parents requested it not be, and it happened twice. An employee of Mass General left private information on a train on her way into work. The information was never recovered, and it affected 192 patients. CVS had to pay $2.25 million for throwing away health records in dumpsters, not training their employees, and not implementing sanctions for employees who did not comply with policies. The reasons why healthcare professionals are not following HIPAA is varied. Sometimes it's just gossip and curiosity, and other times it's lack of training and communication. Because of this, it is hard to come up with a solution. Nurses strive to provide patients with the best possible care. Breaching confidentiality related to personal information can be avoided by seeking appropriate training, staying informed, and not being careless. A common misconception is that it is all about technology. It is actually about how we collect and use information and ensure that it is protected. It all depends on how well people follow the rules.